All right, we'll go ahead and get started. Let's just kind of introduce ourselves and our relationship to one another. So, Mom, if you want to go first,
I'm
you can.
Tracy Lee, otherwise known as Mom, and today's actually my 50th birthday. We are recording from Brea, California.
And my name is Diamond Lee. I'm her daughter, and I am 24 years old. I'll be 25 this year. Today is January 6th. Currently, you are a nurse. You're an LVN, and you've been a nurse majority of my life. If you can, just kind of start out by telling me a little bit about your experience with healthcare as a child.
Growing up, I think healthcare wasn't something talked about. We didn't talk about healthy diet or regular dental appointments. It just really wasn't something that financially on our radar. Both my parents worked jobs where they didn't really have healthcare benefits or I guess even access. My father owned a car wash for many years in Santa Monica when I was growing up. And then my mom worked as a housekeeper, so she didn't have medical benefits either. I think at some point we had state aid and there was a community clinic in our neighborhood. So it was the Watts Health Foundation. And we did go there if we were sick, if something happened. So I remember at 10, I was riding my bike and fell and broke my arm and chipped my 2 front teeth. That's where I had my x-ray and had all of that. They had a dental clinic inside. That's where I went to the dentist. If you were going to school and school said it's time for vaccines or something like that, we went, we did the vaccines. But in terms of just kind of regular maintenance and annual dental checkups and regular medical checkups, it wasn't something that we did. I'm the youngest of 10, so I think that's just a lot of kids. So that's what it was like a little bit as a younger person growing up. I remember having this horrible dental infection and I needed to have the tooth pulled, and my sisters, 2 of my older sisters, had taken me in, or a root canal, I'm sorry, and they were like terrified of the fact that I was going to have a root canal. And I remember not going back and just kind of living with that rotten tooth for a while until it affected 10 other teeth, and I was 16
Wow.
or something, trying to have all this massive dental work done. It just wasn't something on our radar as a family in that community growing up. You have to really determine where your money is going to go. Is it going to go to keeping the electricity and the water on, or is it going to go to going to the dentist every 6 months or something for a cleaning? And then part of it is just education on what's needed or the long-term effect when you are not seeking regular health care. Having you and your brother, I remember you guys, when you hit your 1-year mark, one of the first things I did was schedule dental appointments for you. That was just a regular norm that you went in every 6 months for cleaning and annually for checkups, because I knew the flip side of that.
I'm just curious, what even made you look at nursing or healthcare even as a career path?
I graduated from high school and I didn't go directly into college and was just kind of not sure what I was going to do. I had a friend who was going to a medical assistant program. I joined that. I would go with her. I would walk to her house. She'd drive. She didn't finish the program, but I did. I went into the LVM program, really enjoyed it, really blessed just getting jobs and hadn't had any issue. I worked for many, many years in hospice, loved that, and another 10 years working OBGYN, first as a liaison and then a supervisor, and then transitioned into Providence Medical Foundation. It's been really good. It's afforded me a lot of opportunities. Things that I learn, I'm able to share with other people.
Just from growing up with you as my mom, you have some of the best stories.
At work, there's something that we do, which is new caregiver orientation, and we share something called Sacred Encounters. I worked in OBGYN at another healthcare organization, so I'd gone over to the hospital cafeteria to get breakfast. There was a lady ordering in front of me, and she turned and she said, "Tracy," and I thought, I don't know you, lady, and I was just feeling kind of, I don't know, I guess maybe a little selfish or self-absorbed at that moment, and she said, "It is Tracy, isn't it?" And I said, "Yes." And she said, "You probably don't remember me." And she said, "I was a patient and I was homeless and pregnant, and you were so kind to me and treated me with so much respect, and you gave me samples of diapers and baby formula and and every time I came, you would give me something. So she kind of opened her coat and she said, I'm not homeless anymore. I work here now. And she said, I went back to school and I became a CNA. And she said, and guess what? A year ago, I had breast cancer. I would have never even found out if I didn't work here and have insurance. I was just really kind of like, okay, God, that was a God moment where you show up and He's like, other people may not see you in this moment, but I see you in the work that you're
Yeah.
doing. That's what I call a sacred encounter.